Pope Francis' recent battle with a respiratory infection sheds light on a growing health concern: polymicrobial infections. These complex conditions occur when multiple pathogens, bacteria, viruses, and fungi invade the lungs simultaneously, making treatment a daunting challenge. For the elderly, like the Pope at 87, the risks are even greater. Unlike typical infections, these polymicrobial cases can evade the immune system, prolonging symptoms and complicating recovery. Current research is shifting towards targeted therapies that consider the unique combinations of microbes involved. Understanding these interactions is crucial for improving treatment strategies. As we witness the Pope's health struggles, it serves as a stark reminder of the importance of early diagnosis and comprehensive care in combating these potentially life-threatening infections. Polymicrobial respiratory infections occur when multiple types of microorganisms, such as bacteria, viruses, and fungi, infect the respiratory system at the same time. Unlike single pathogen infections, these mixed infections present unique challenges because the different microbes interact in ways that can make symptoms more severe and treatments less effective. This complexity makes diagnosing and managing these infections much more difficult, particularly in high-risk individuals such as the elderly, immunocompromised patients, and those with chronic lung diseases. One key issue with polymicrobial infections is that the pathogens can enhance each other's survival. For instance, certain bacteria can weaken lung tissue, making it easier for viruses to spread, while some fungi can alter the immune response, allowing bacterial infections to take hold more aggressively. This interaction creates a vicious cycle where the infection worsens over time if not properly treated. Traditional treatment approaches that target only one type of microorganism often fail, leading to prolonged illness and higher mortality rates. Pope Francis' recent health concerns highlight the risks associated with polymicrobial infections, especially for older adults. At his age, the immune system does not respond as robustly to infections, making recovery slower and complications more likely. As doctors monitor his condition, they must consider the possibility of a mixed infection and ensure that treatment strategies address all contributing pathogens. His case serves as a reminder that comprehensive diagnostic tools and personalized treatment approaches are essential in managing these infections effectively. Polymicrobial respiratory infections pose the greatest threat to individuals with weakened immune systems. Elderly adults, like Pope Francis, are at a significantly higher risk due to age-related immune decline. As people grow older, their bodies produce fewer immune cells, making it harder to fight off infections effectively. This means that even a mild respiratory illness can escalate quickly when multiple pathogens are involved. In addition, older adults often have underlying conditions such as chronic obstructive pulmonary disease, COPD, diabetes, or heart disease, all of which can further compromise their ability to recover from respiratory infections. Apart from age-related vulnerability, immunocompromised individuals, such as cancer patients undergoing chemotherapy, organ transplant recipients on immunosuppressants, and people with HIV/AIDS, are particularly at risk. Their immune systems are already weakened, making it easier for bacteria, viruses, and fungi to take hold simultaneously. In these cases, a minor respiratory infection can rapidly progress into severe pneumonia or systemic infections, requiring intensive medical intervention. Hospitalized patients are another high-risk group, especially those who require ventilators or long-term oxygen support. In hospital settings, patients are exposed to drug-resistant bacteria and fungi that can worsen polymicrobial infections. These superbugs, often found in intensive care units, make treatment more complicated and can lead to life-threatening complications. Pope Francis' hospitalization raises concerns about potential hospital-acquired infections, which could make his condition even more serious if not carefully managed. Polymicrobial respiratory infections involve a complex mix of bacteria, viruses, and fungi working together to worsen a patient's condition. Some of the most common bacterial culprits include Streptococcus pneumoniae, Haemophilus influenza, and Staphylococcus aureus. These bacteria often cause pneumonia and other lung infections, but become more dangerous when combined with viral pathogens such as influenza or SARS-CoV. 2. The virus responsible for COVID-19. When these microbes interact, the body's immune response can become overwhelmed, leading to severe respiratory distress and complications like sepsis. Viruses also play a significant role in polymicrobial infections. Influenza and respiratory syncytial virus, RSV, frequently weaken the respiratory tract, making it easier for bacterial infections to take hold. In some cases, a viral infection damages the lungs' protective barriers, allowing bacteria to invade deeper into the tissue. COVID-19, in particular, has been linked to severe secondary bacterial infections, contributing to increased mortality rates during the pandemic. If Pope Francis' recent infection involves a viral component, his risk of bacterial co-infection and complications is significantly heightened. Fungal infections, although less common, can further complicate polymicrobial respiratory infections. Aspergillus and Candida species are particularly concerning for immunocompromised patients, including the elderly. These fungi thrive in weakened lung environments and can be resistant to standard treatments. In hospital settings, fungal infections are even more dangerous, as they often accompany prolonged antibiotic use or mechanical ventilation. If not identified early, fungal co-infections can be fatal, making early diagnosis and targeted treatment essential. Polymicrobial respiratory infections often present with overlapping symptoms, making them difficult to diagnose early. Patients typically experience persistent coughing, difficulty breathing, fever, and chest pain. However, because multiple pathogens are involved, symptoms can be more severe and progress rapidly. For instance, a viral infection may start with mild flu-like symptoms but quickly escalate when bacterial or fungal infections develop. This rapid worsening is particularly dangerous for elderly patients like Pope Francis, whose immune system may struggle to contain the infection. As the infection progresses, more serious complications can arise. Severe cases may lead to pneumonia, in which the lungs become inflamed and filled with fluid, making breathing extremely difficult. In some cases, polymicrobial infections can cause acute respiratory distress syndrome, the RDS, a life-threatening condition where oxygen levels drop critically low. If multiple pathogens are attacking the lungs at the same time, the body's inflammatory response may go into overdrive, potentially leading to organ failure. Early medical intervention is crucial to prevent these complications. In hospital settings, doctors monitor vital signs and oxygen levels closely to detect signs of deterioration. Patients may require oxygen therapy or mechanical ventilation if breathing becomes too difficult. Pope Francis' medical team is likely following strict protocols to ensure his respiratory function remains stable. However, if secondary bacterial or fungal infections emerge, they could complicate treatment and prolong recovery. This highlights the importance of early detection and targeted therapies to address all potential pathogens involved. Managing polymicrobial respiratory infections requires a multifaceted treatment approach that addresses each pathogen concurrently. Clinicians often employ a combination of broad-spectrum antibiotics, antiviral agents, and antifungal medications to combat the diverse microbial population. This tailored approach is critical because using a single therapy may fail to eradicate all the pathogens, allowing some to persist and worsen the infection. Physicians must carefully select drug regimens based on the patient's age, immune status, and potential drug interactions to optimize recovery. Despite these strategies, treatment remains challenging due to the dynamic interactions between pathogens. The presence of multiple microbes can lead to rapid changes in resistance patterns, complicating the effectiveness of standard therapies. Moreover, the patient's underlying conditions, such as weakened immunity or chronic diseases, further reduce the response to treatment. Continuous monitoring and adjustments in medication are often necessary, and healthcare providers may use diagnostic tests to guide the selection of appropriate drugs throughout the treatment course. Early detection and personalized treatment plans are essential for improving outcomes in patients with polymicrobial infections. Innovative diagnostic tools, such as rapid molecular testing and imaging techniques, allow clinicians to identify the specific pathogens involved quickly. This precision medicine approach not only enhances the effectiveness of treatment, but also minimizes the risk of adverse drug reactions. By continuously adapting treatment protocols to the evolving infection, healthcare professionals can better manage complications and support recovery, ultimately reducing mortality and improving quality of life for vulnerable patients. Timely, coordinated care remains the cornerstone of success in practice. Preventing polymicrobial respiratory infections begins with proactive community health practices. Rigorous hand hygiene, the proper use of masks, and widespread vaccination campaigns form the cornerstone of these efforts. For vulnerable groups, especially the elderly and immunocompromised, such measures can dramatically reduce the risk of infection. Public education initiatives and awareness campaigns are essential to ensure that individuals understand and adhere to these practices, creating a collective shield against the spread of multiple pathogens. In healthcare settings, stringent infection control protocols are vital. Hospitals and clinics enforce strict sterilization of equipment, isolation procedures for infected patients, and regular disinfection of surfaces to minimize cross-contamination. Advanced air filtration and controlled ventilation systems further help to contain airborne pathogens. These measures protect not only high-risk patients, such as Pope Francis, but also the medical professionals who are constantly on the front line. Continuous staff training and adherence to updated guidelines ensure that these environments remain as safe as possible. On a broader scale, robust public health policies and early screening programs are key to curbing outbreaks. Routine surveillance and rapid diagnostic testing enable the timely identification of emerging infections before they evolve into full-blown epidemics. Investment in research for targeted vaccines and innovative treatments enhances the overall ability to combat these complex infections. Through coordinated efforts between government agencies, healthcare institutions, and local communities, a comprehensive strategy can be developed that significantly reduces the incidence and severity of polymicrobial respiratory infections. Advancements in genomic sequencing, rapid diagnostics, and AI-driven analytics are revolutionizing our understanding of polymicrobial respiratory infections. Researchers are now able to identify multiple pathogens in a single sample, allowing for more targeted treatments. This innovative approach is crucial for patients like Pope Francis, whose vulnerability demands prompt and precise diagnosis. By integrating traditional laboratory techniques with cutting-edge technology, medical professionals can quickly adapt treatment protocols and improve patient outcomes. New diagnostic tools, such as point-of-care testing and multiplex PCR assays, have greatly reduced the time needed to identify the pathogens involved. These tests can simultaneously detect bacteria, viruses, and fungi, enabling clinicians to tailor therapies more effectively. In addition, advances in imaging technology provide a clearer picture of the infection's progression within the lungs. The combination of rapid diagnostics and high-resolution imaging is proving to be a game-changer in managing complex respiratory infections, paving the way for personalized medicine and more efficient care. Ongoing research also focuses on developing novel therapeutics that target the intricate interactions between co-infecting pathogens. By understanding these interactions at a molecular level, scientists aim to create treatment regimens that disrupt the synergy among pathogens. Collaborative efforts between academic institutions, pharmaceutical companies, and healthcare providers are accelerating these breakthroughs. Ultimately, these innovations offer hope not only for high-risk patients, such as Pope Francis, but also for broader populations, reducing morbidity and mortality associated with polymicrobial respiratory infections. These advancements not only redefine clinical practice, but also inspire hope for a future with fewer infection-related tragedies. The global burden of polymicrobial respiratory infections is prompting healthcare systems worldwide to rethink preparedness and response strategies. With rising cases and the evolving nature of pathogens, the impact on public health and economies is significant. Pope Francis' situation has underscored the vulnerability of aging populations and ignited international conversations on enhancing healthcare policies. This scenario calls for unified, proactive measures that transcend national borders, highlighting the urgency for improved early detection, robust vaccination programs, and coordinated global surveillance systems to mitigate future outbreaks. Looking ahead, future perspectives center on innovation, international research collaborations, and technological advancements that can revolutionize diagnostics and treatment. Experts emphasize the need for increased funding and research, particularly in the areas of rapid molecular diagnostics and personalized medicine. Collaborative efforts among governments, academic institutions, and pharmaceutical companies are expected to drive breakthroughs in combating drug resistance and streamlining treatment protocols. These initiatives promise to pave the way for a more resilient healthcare framework capable of addressing not only current challenges, but also unforeseen infectious threats. Policy implications arising from these challenges are far-reaching. Governments and global health organizations are urged to develop comprehensive policies that integrate prevention, early intervention, and continuous monitoring of respiratory infections. This includes revising regulatory frameworks, improving healthcare infrastructure, and establishing emergency response plans that can be rapidly deployed. The experience of managing Pope Francis' condition serves as a poignant reminder that coordinated international policy efforts and proactive healthcare planning are critical to safeguarding public health and ensuring that vulnerable populations receive the care they need. Pope Francis' ongoing battle with a polymicrobial respiratory infection serves as a stark reminder of the urgent need for heightened awareness, research, and preparedness. His condition has highlighted the vulnerability of the elderly and immunocompromised, reinforcing the importance of early detection, personalized treatment, and preventive measures. While medical advancements have significantly improved our ability to diagnose and manage these infections, the challenge remains formidable. The complexity of multiple pathogens interacting within the respiratory system requires continuous innovation, collaboration, and vigilance. Healthcare systems around the world must strengthen their capacity to combat emerging infections. Hospitals, research institutions, and policymakers must work together to improve diagnostic accuracy, develop targeted therapies, and implement stringent infection control protocols. Public awareness campaigns should also play a central role, educating communities about the importance of vaccination, hygiene practices, and early symptom recognition. The lessons learned from Pope Francis' case should not be forgotten. Rather, they should serve as a catalyst for meaningful change in healthcare policies and practices. Ultimately, the fight against polymicrobial respiratory infections is a shared responsibility. Whether through supporting scientific research, advocating for stronger healthcare policies, or simply practicing good hygiene, everyone has a role to play. As the world watches Pope Francis' recovery, let this moment be a turning point in how we address infectious diseases. By prioritizing early intervention, innovation, and collaboration, we can move toward a future where such infections pose less of a threat to our most vulnerable populations. The time to act is now.